Hello and welcome to Cameroon. My name is Katie Satcham. I'm a second year PEDS resident, and since I can't be with you for the Global Health Grand Rounds, I'm making a short little video for you guys to see where I am at and what I'm doing. You can see the beautiful view here. This is right outside of where I live. I'll have the camera sort of pan around. This is the hostel where the short-term volunteers stay, with a kitchen right here and a cook that makes our meals. And then throughout the compound there are more permanent houses for your missionaries who are here for several years, and then also the local residents who are here have housing as well right here. So I've been here for almost 3 weeks, and we'll be here another week longer, and so you can just come with me and I'll show you a few places in the hospital and tell you a bit about what I've been doing. Alright, so here we are on the children's ward of Mbingo Baptist Hospital, which is where I'm working. It's, I believe, a 250 bed hospital, and here in the pediatric area there are 20 general peds med-surg beds and then another 6 oncology beds. The hospital runs very similar to how it runs at home. We have rounds in the morning. The local residents are in kind of a med-peds residency program, although they only do 25% of their time in pediatrics. And so they see the patients in the morning, do their pre-rounding, and then around 9:30 we all do sort of rounds as a team and see the patients and do teaching, and very similar to what we do at home, which is really fun to see. And next we'll head over to the nursery and I'll show you our little newborn area and our little mini NICU where we have some patients right now. Alright, so here we are in our little NICU closet. Right now we have 2 little babies, both 26 weeks. The first one here was born the day I came, and so it's been really fun to watch her grow and do well, working up on feeds, and both of them are on Bubbles CPAP right now for respiratory support. And you can see this little baby, who's I think about 3 days old, is on phototherapy for jaundice, and that kind of has led into the project that I'm working on. Dr. Slusher was with me for the first couple of weeks, and as you know, neonatal jaundice is her area of research interest, and so what we've done is to try to improve their phototherapy. And so these units are their older phototherapy units that have about 3 bulbs, which are probably old, and we measured the irradiance that they're supposed to give, and they were between 2 and 4. I believe the units are microwatts per centimeter per nanometer squared, and it should be at between 10 and 30. And so, as Dr. Slusher says, that they were doing fake phototherapy, and so what I'm trying to do in my last few days here is to help develop a better phototherapy units for them, so they can actually be making the impact in the bilirubin levels. And so you can see here is sort of a mock-up of our new system that has 7 brand new bulbs, which brings the irradiance up from about 4 to 20. And then with some other simple changes like having a white blanket in the bed, making sure everything is clean, all those things can really improve their phototherapy. And so that's my project that I'm working on. My husband's an engineer and he's working with the electricians here to make these phototherapy units.